Okay, looks like it's 10:06. We've got all of our council members save for one, so we'll get going and see if they join us. I do have a few little updates from the end of our last meeting. We had some questions. But I should first say, welcome back, everybody. Everybody joining us via Zoom, welcome. I hope everybody had a good holiday season and a happy new year to everybody. So a couple quick updates. We ended last session with a bunch of questions about kind of how to conduct our meetings and some of the tricky details. And I was able to chat with a DOR attorney, and they were good enough to help us out on some of these things. So quickly running through them, we wanted to know, can we communicate via email between meetings? And the answer is generally yes, with some important points. Number one, you can communicate via email so long as no quorum exists and no substantive decisions are made via email. And then we all recognize that those emails could be a part of a public records request. I don't think any of those points pose a major concern. If in between meetings, as a quick example, you want to share a link to an interesting study that is relevant with another member, I don't see any kind of an issue with that. For many of us participating here as state workers, our emails are already considered public records, so there's kind of no change there, and that really only affects our public members. Let's see, so there's that. We had a question about how we would give public access to any documents or studies that are reviewed by the council. So what we did is we've got a web page set up. It's a subpage of the Cannabis Control Division website. And I will collect any links or documents, and we'll keep them available there. So if anybody has a study or a link that you're drawing information from, please provide that resource to me, and I will get it posted. So it's public. Recordings of the meetings will be stored there as well. As a reminder, these are recorded. This is being recorded currently. Each meeting will be posted. It may take just a few days for all that to happen, but we'll get them up quick. The first meeting we had, unfortunately, the audio quality was not great, and we had a couple people that were out of frame of the camera. We are in a different meeting room now with additional microphones, and we have tested this, and it seems to be better. So hopefully that is the case, and it should alleviate those issues. Let's see, next on the list, there was a question about guest speakers and or witnesses coming to give testimony or information. That is just fine. If we come across a need for that, let me know, and I can help coordinate. Guest speakers or witnesses must be available to field questions from the public, however. We just got to make sure we allow time for that. And then lastly, speaking of public comment availability, we will be taking public comments via email. We're going to use the general inbox for CCD. And I will post a link to that on our site as well, of course. But for now, it is dorccd@mt.gov. That's dorccd@mt.gov. We can compile those public comments from there. I'm getting a note that the audio sounds good. Excellent. Okay, any questions or comments, concerns about any of that before we get going? Seeing none. Great. Okay. Kathy Wigan Palmer, our presiding officer, was going to do a presentation on some of the synthetic products that have been found around the state. So with that, take it away, Kathy.
Great, thanks, Andrew. Hi, everyone. Welcome back. Happy 2024. So I do have a presentation that is just basically full of pictures of products that we have found. Well, Shane Bancroft has found, who's on the meeting, actually. He's our synthetic inspector. So these are all pictures that he's taken from his inspections that he's conducted out in the field. And I wanted to do this to kind of give you all in the audience a taste of what is out there. These products are in Montana. This is a Montana problem. And so what I'd like to have happen is I'll start the presentation. I'll kind of lead us all off. I have some good notes in there. I'll kind of show you some commonalities in these products. And as we continue through the presentation, I'll kind of open it up more for some dialogue and some back and forth, and we can discuss these products as we go along in the presentation. And then following the presentation, we'll have an open discussion about some of the resources or references or articles that you folks may have found over the last month, and we can kind of see where the conversation takes us from there. So just bear with me here and I'll see if I can't get my screen shared. All right, how's that look on your end?
Perfect.
Right.
You might want to, can you go to Teams and put Teams on Do Not Disturb? Because we're seeing your previews. So just open up Teams and do Not Disturb, and then you'll be ready to rock. Looks good though.
Okay. All righty, so we'll get started here. So synthetic marijuana products and what we find in Montana. Oh, shoot. So I just want to do a little recap. Oh, shoot. Are you guys seeing this taskbar up here? I'm guessing not. Okay, so
Nope,
we'll do a House Bill 948 recap on the language here, since it's been a month since we've all talked about this. So we're basically talking about synthetic cannabinoids here. And so what is a synthetic cannabinoid? Well, per House Bill 948, a synthetic cannabinoid is any cannabinoid that is produced artificially, whether that's through a chemical synthesis or a biological synthesis. And biological synthesis here means any recombinant biological agents, so genetically modified yeasts or algae. Believe it or not, that's a thing that people have figured out how to do. And then a synthetic marijuana product is any product that contains these synthetic cannabinoids. So down here on the bottom left, you'll see I've put out a list of some of the common synthetic cannabinoids that we run into. Those are your Delta 8, your Delta 10, THCO, THCP, VB. But be aware that just because THC may not be in the name doesn't mean that it's not intoxicating. So HHC is an example of that. HHC is intoxicating. And then we have this kind of outlier, which is CBN, which is most typically made synthetically. However, it's not generally considered intoxicating. And I also have a list here of the common elements that you'll find on some of these synthetic product labels and packaging. And this is just kind of a list that I threw together that I've seen personally from interacting with Shane and talking about the products he's coming across. And so almost all of these labels will contain some language that nods to the federal farm bill, and they'll say things like hemp derived or farm bill compliant, or this product has less than 0.3% Delta 9 THC. Some of them make or allude to certain effects that the product will have, whether that's calming or invigorating, or you'll get a social high or a buzz. A lot of them are brightly colored, and the packaging or the images on the packaging are appealing to children. And the edibles typically come in forms that consumers are used to seeing, and that could be candies or gummies or even cereals, chips, you name it, the product is out there. And as far as candies and gummies go, they can even take the form of like a physical gummy bear. Whereas in our marijuana program, that is something that you can't do. You can have gummies, but they can't be in the shape of a gummy bear. A lot of these products have QR codes. These codes generally take you to either the website and or some sort of testing results called certificates of analysis, COAs. Sometimes those links are broken, and we'll discuss that a little bit further later on. A lot of the products have some sort of FDA statement, and it's not a positive statement. It's a FDA statement that says something like the FDA does not approve of these products. And then lastly, you'll see some certificates of analysis sometimes. These are typically buried in the website. A lot of the time they'll say there's a C of A and there's not, or they're missing or suspicious. A lot of the times these C of A's are actually fraudulently made, and if you trace them back to the laboratory that's on that certificate, the laboratory can't find those results. So one last graphic before we jump into some pictures here. I like this graphic because it really easily shows how intoxicating some of these cannabinoids are. So all of these graphs are in relation to the intoxicating effects of delta-9 THC. So as you can see, delta-8, HHC, THCO, they're relatively the same amount of intoxicating, or their potency levels are about the same as delta-9 THC. Delta-8's a little bit less, THCO is about 3 times more. But when you get into these THCB, THCP, HHCP, they're purportedly 30 or more times more potent than delta-9 THC. And I've put these red stars above the cannabinoids that we're going to see in this presentation today. So as you can see, Montana definitely has products in our state that contain synthetic cannabinoids that are over 30 times more potent than what we're regulating in our legal marijuana program. All right, now we'll get into some pictures here. So this is a vapor cartridge product, brightly colored. I've circled this THCX. I'm actually not even quite sure what this is. I'm having a hard time finding any meaningful data on what THCX means. It might just mean extreme, or some sort of, nod to, hey, this is a brand new cannabinoid. And it even says that down here, new cannabinoid. And then when you flip the product over, you'll see, it alludes to that this product will give an intoxicating effect because you're not supposed to operate heavy machinery when you use it. Here's a QR code that we were discussing. And then in the, I guess you could call this ingredients list, sort of, it says hemp derived, right? That's a nod to the Farm Bill. THCX, again, not super sure what that is. THCP, THCB, CBD, CBN, but because it's legal, because it has less than 0.3% delta-9 THC, even though this is a highly intoxicating product. This contains 2 cannabinoids that are over 30% or 30 times more potent than delta-9. And you can see on the front of the label, it only mentioned 1 cannabinoid, but on the back, there's 4 here. And then this other circled piece down below, again, another nod to the Farm Bill saying, hey, but this is Farm Bill compliant, leading people to think, oh, this is okay. But in Montana, now with House Bill 948, this product is prohibited. So here is a pre-roll product. The front of the package lets you know that it has HHC in it, another synthetic. When you move to the back of the product, it has the ingredients listed at the top. It says that it has this HHC distillate, It uses the term hemp a lot, meaning, hey, this is actually a hemp product. And then there's another list of warnings here. You have to be over 21. Again, it has less than the 0.3% delta-9 THC. It does, oddly enough, say that HHC is not a controlled substance, and that's a kind of misleading statement. It kind of depends on which case law you're looking at across the nation. Different cannabinoids and different courts are coming up to different conclusions here on this. And then below here, here's your QR code. I scanned this, went to the website. It didn't take me, well, it took me to the website, excuse me, but I could not find any testing results on the webpage at all. And like we discussed last month, testing is not the cure-all here. Even if the product is tested, they're still unsafe for all the reasons we discussed last month. And as I'm going along, you guys feel free to raise your hand, ask questions. This is kind of just education for everyone. It's fun to kind of it's interesting to kind of sit down and talk about these labels and see what you're seeing and discuss it. So feel free to interrupt. Here's another pre-roll in a very brightly colored package. Here at the very top, it says this includes these two synthetics, the THCP and HHCP. Those are over 30 times more intoxicating than Delta-9. When you roll this cartridge over, you'll see that actually it lists out 8 synthetic cannabinoids. So we have Delta-8, 10, 11, HHC, THCP, HCCP, THCB, THC. It's alphabet soup. And then again, it's saying, oh, but it's 100% hemp derived. So if it's less than 0.3% Delta-9 THC, and it's derived from hemp, it's purportedly okay from the federal standpoint, from the federal farm bill. Go on to the next one here. Some more cartridges. We'll stray away from cartridges here in a minute. But right on the front, sticker says derived from industrial hemp, another intoxicating HHC, the cannabinoid there. Here's another one with a fun little cactus on the front, 6-shooter HHC. More warnings on the back, right? Again, don't drive or operate heavy equipment because it is intoxicating and they know that. This one also has some, pregnant and breastfeeding warnings on here. Ingredients, hemp derived HHC. The thing that kind of stands out to me on this particular one is right here. It says the quantities mentioned on the packaging may vary by plus or minus 25%. That's a lot. That can be a pretty big variance depending on the concentration of this product. And again, some nods to the Farm Bill. Here's another little QR code that may or may not take you to a meaningful place on their website. Another cartridge product that this one's interesting because it actually includes nicotine as well. So not only is this a synthetic cannabinoid product, this is a nicotine product. Let's see here on the backside, some more warnings about operating heavy equipment and another nod to the Farm Bill. This is one of the first cartridges that actually puts a concentration of the synthetic cannabinoid that's in this product. The other ones were kind of vague on actually how much was in there. Nice little monkey on the back of the package. And so just a selection of vapor cartridge products and some edibles in there. I've circled one at the very end here. This says unicorn smoothie. I think that would be considered appealing to children, right? It's using language and graphics that little kids would probably be interested in looking at and maybe opening and consuming. So here's some flower product. So this is hemp flower that has been infused with HHC, a synthetic cannabinoid. A lot of the times this is done by either spraying the product with HHC extract or concentrate, or you can also perhaps have a solid product that you grind up and mix in with the flower. You can see on the products here, again, it's talking about the Farm Bill and how the Farm Bill made these products legal. Some more hemp flower products. This is Delta 8. One has THCO. Again, same process here. They're taking what is maybe legal hemp flower and infusing it with synthetic cannabinoids here. And a lot of the strain names that you'll see here are strain names that you'll actually see in the marijuana industry as well. Now we'll get into some edibles. So on the left here, this koi product has Delta 8, 9, and 10. And this looks to me like Pop Rocks, which is a popular kids candy product, probably familiar with. And so that's a consumer good that exists in the general retail space. Here are some gummies with HHC. Something to note here is that these contain 12.5 milligrams per serving, which is over the milligram per serving limit that we have in the legal marijuana program. So in the program, recreational products cannot have any more than 10 milligrams of THC per serving and 100 milligrams per package. And so this one is technically over. Not by much. There's a couple other examples in here that are over by a lot, but this is technically even over what we have in our legal program. So here's a kind of looks like an energy shot. I'm not sure if there's any sort of caffeine or something like that included in this product, but there is the synthetics Delta 8, 9, and 10. And so here's some hometown hero products. We see these a lot. They apparently support veterans, which is great. However, they are selling these intoxicating products that are kind of exploiting a loophole with the Farm Bill. So the one on the left here has Delta 8, and as you can see, this one has 25 milligrams per gummy, which is a serving. So that one is 2.5 times over our legal marijuana limit in our state-run program. And when I look at the label here on the right, Cinna Crunch Squares, 400 milligram Delta 8 cereal squares. What does that make people think of? Do you think you've seen this consumer product somewhere in the grocery stores? Maybe a product called Cinnamon Toast Crunch. So this is, it's kind of imitating consumer products that already exist. When I scanned this QR code here in the bottom left, it took me to an error page. It says the page was not found. And if you can see right below here, it says scan for C of A. And again, C of A is certificate of analysis. So they're saying that there's some test results somewhere. When you scan it, it says page not found. And that's pretty typical for these products. So of all the edible products and the concentration of synthetics found in them, this was the worst offender by far. This is XXL 7,000 milligram gummies. So there are 7,000 milligrams of synthetic cannabinoids in this container. Since there are 20 pieces, that means that each serving has 350 milligrams of THC, P, and HHCP. And then remember, those two cannabinoids are over 30 times more intoxicating than Delta 9. And then on top of that, there's 35 times more the limit per serving in each gummy when compared to our legal program. So again, our legal program allows 10 milligrams per serving. This has 350 milligrams per serving. And per container, our program allows for 100 milligrams of THC per container. This container has 7,000. So this is a highly, highly intoxicating product that is being sold outside of our regulated program in retail businesses. So here's another edible product. This one has supposedly 500 milligrams of THCO and is also infused with Delta 8 THC. I scanned the QR code here and I was able to find a certificate of analysis. However, there still are some sort of weird things going on here. As you can see, hopefully it's kind of small, but the cannabinoid profile, so the table under that language is the test results for the potency. THCO, which is on the label of this product, is not included in the testing results here. So that's interesting to me that they're making a label claim that it contains a cannabinoid when they haven't even tested for it. However, Delta 8 THC is included in this test result. The other thing that I've picked up on is that the picture in this C of A, has the pictures of the products that these results pertain to. The bottom left pink one right here is probably hard to see. That is the same product that is here in this slide. However, the packaging is slightly different. So it leads me to think that, well, maybe this actually isn't quite the same product. It might be similar. The other thing about the C of A is that the testing was done in 2021 and these pictures were taken in the fall of 2023. So I find it hard to believe that these test results really are even valid at this point. I would assume that they have since then made a new process lot of these gummies. Additionally, the gummy here on the packaging is in the shape of what can be strewed, I would say, as a hemp or a marijuana leaf. That shape could be considered appealing to children. I could see how you can maybe think that's a flower or something. And then lastly, back to the C of A, I didn't post it here. This C of A is actually 3 pages long. The first page has the testing and results for the cannabinoids, and the remaining pages were left blank, and that's where contaminant testing was listed, but there was no contaminant testing done. That's fairly typical. And again, even if the product is tested for contaminants, like we discussed, the synthetic process here to make these products creates compounds that any amount of testing won't catch. And so sure, it's tested, but it doesn't really mean much, especially in this case when they didn't test for contaminants. So here's another edible candy, gummy worms, right? We've all seen gummy worms. These are really prevalent candies. Buy them at gas stations, right? This would be a product that you could not make in this form in our regulated program. But here they are. It looks like anything one of our kids may consume. However, these have synthetic cannabinoids in them. Again, THCO, gummy worms. They are, again, over our milligrams per serving and milligrams per package threshold in the state. Big QR code here, scan for lab results. Okay, well, I did, and it had a big list of edible lab results, and this product was not listed there. They had similar products. However, I was not able to find any THCO gummies. The only ones I could find were Delta 8 gummies. And so it's kind of misleading. And again, the C of A's they're easy to manipulate. I've spoken with other states where if they go back and contact the laboratory that's on these C of A's, those laboratories can't find the results. And so those electronic C of A's have been manipulated. So here's some beverages. This is kind of an interesting one because Here we see HHC on the packaging, that's a synthetic cannabinoid, but when you zoom in right here, HHC is actually their company name, stands for hard hitting cannabinoids, which the name kind of alludes to, well, maybe, this is a kind of an intoxicating product. It leads to some sort of effect, right? The other kind of interesting thing here is that one bottle has 10 servings. So most people, when you have a beverage in your hand, the typical serving size is the entire can or bottle. In this case, it's not. There are 10 servings. And so if you're not a diligent consumer and you're not reading the fine print here, you could easily consume this whole product and take 10 times the amount of cannabinoids than the product intended. Which it opens the door for having bad experiences and intoxicating effects that you weren't expecting. And again, here I have some things underlined. It does contain this particular one contains delta 8 THC. The other one has HHC. And all the same sort of warnings and statements on the label here. The less than 0.3% delta 9 THC. Product hasn't been evaluated by the FDA. So they all kind of have the same commonalities as we're looking at these. Any questions so far? Comments? Okay, I'll take that as a no. Here's a cookie. HHC cookie, birthday cake, high potency. Again, this cookie has more milligrams per serving than what's allowed in our legal marijuana program. HHC, that's a synthetic cannabinoid. You look at the back here. I know it's kind of small, but it has all those same commonalities that we've been talking about, the Farm Bill language, FDA statements, everything. This is probably my favorite slide of the whole presentation. So here we have some packages of cereals that are intoxicating. They have a variety of different synthetics in them, Delta 8 on these honey lips over here, so the Delta 10 here. So these look like really familiar cereals, don't they? It took me about 2 minutes to go online and take screenshots of the cereals that these are imitating, right? And some of them are very, very close, particularly the Honey Smacks. It's basically the same exact picture. It just has, slightly different names. But it's pretty profound how closely these are imitating everyday consumer products that the everyday consumer is feeding their family.
Kathy, a quick question. Is it fair to say there's probably then multiple violations going on with those products? Like if you're copyright, whatever issues with that Honey Smacks cartoon?
Yeah, I would say that's probably a fair assessment. I personally, from memory, can't read any sort of litigation that may have happened about this. Mm-hmm. It might also be that Kellogg might not even know that this is a problem, or at least not yet.
Yeah.
But I would assume, because you see sort of that infringement stuff in the news for other products.
Yes.
I would guess, I'm just guessing, it's my personal opinion, that maybe they just haven't quite caught on yet.
Mm-hmm. Interesting.
Yeah, it's very, it's pretty brazen how close they are, right? Very, very interesting. And this particular issue is what makes accidental consumption and intoxication, particularly from children, so bad. Right? Because there's no regulation here that says that these companies and these manufacturers that are doing this, that they can't. And so they're just kind of going crazy with it.
And then, maybe this is going off on a tangent. How is it, why are gas stations it seems like they're the outlet source for all of these products typically. How did gas stations get that role?
So two things here. And Shane, you can chime in too on this. So most of these, the majority of these products are actually not coming from gas stations in this state. These are all being found in glass shops or vape shops, smoke shops.
Okay.
Shane, correct me if I'm wrong. I think you said you've come across one or two maybe gas stations where they're selling some of these products. Maybe not these specific, like really bad examples, but some products. But
I apologize. As of now, I've literally found these products only in one gas station in the state. They tend to be in specialized tobacco shops, vape shops, and glass shops. I mean, almost exclusively.
Okay, because technically gas stations aren't legally allowed to sell any of these products. Is that correct?
Well, no one's really allowed to sell
No,
these
that's
particular products.
yes.
I see that very frequently they are in tune with any kind of alternative nicotine store where that's their business plan, with vapes and things along those lines. Oftentimes there'll be a separate section of the store just for these products. But as far as the actual gas station itself, I've literally only found one. They said they'd be in compliance, and oddly enough, just later on today, as a matter of fact, I'll be stopping by again on a follow up and inspection to see if they're in compliance.
Mhm. And then as far as the vape shops goes, do they all need like a registration through our state marijuana program?
No, in fact, all the places I go to are open to the general public and are not part of the program at all. These are regular, if you will, retailers who are selling these things. If the inspectors, actually the marijuana inspectors, if they go into a dispensary or something like that and they see this stuff, they handle it. I'm handling things only on the outside of those boundaries.
Okay. Thank you.
yeah, great questions. Anyone else?
Hi, this is John. I was just going to say, I mean, from a, copyright infringement standpoint, just these, the lawyers for Kellogg, I'm sure if they saw this, they would just send the cease and desist letter or, not being a lawyer, I don't know what exactly that would the process be, but that's what'll happen with these if they ever see them.
Yeah, this specific example, I think, carries a lot of weight. It really shows that that these products are and these manufacturers are really brazen, and they there's no sort of self-restraint here.
This is Representative Galloway, if I might comment.
Sure.
So our city came to me with this problem because your legal shops that are going through the program to sell the marijuana might have a shop right across the street that's selling all of this illegal stuff. And that's the whole idea of this bill, was to be able to eliminate that and to be able to get this stuff off the shelves. Because we have people that are paying fees to be in a regulated system, and then we have all this stuff outside the system that really is illegal. And we hopefully in our bill made it illegal.
Yeah, thank you, Representative Galloway. I do believe that the bill has given us the tools and the authority to do that. And Shane Bancroft, our inspector, who's the FTE that the bill gave to us to hire, is doing an excellent job going out and doing exactly that. These products are definitely prohibited. People are listening. It seems like Shane is going out and on follow-up inspections. People are starting to listen and take these off the shelves. And maybe Shane, if you want to add to that, to kind of give people a taste of like what you're seeing and if it's effective.
You bet. I would say that as I've gone around the state since early September when I started, I've probably been to well over 100 locations around the state, and I continue to grows by the week. I find that people who are selling these items, the vast majority um, don't realize that they'll have have no knowledge of House Bill 948 or believe that they are in compliance with it. I have had a tremendous response. I would say probably over 90% of people I've made contact with and found banned products on their shelves on follow-up inspections within the next 3 to 4 weeks after that, those products are gone. The distributors appear to be willing to take this stuff back as, if you will, a product return, and they seem to be trying to help their uh, distributors as well, at least so that they aren't out product. And again, I think because of that, I think it makes the path easily uh, an easier path for them to become compliant when they don't have, it doesn't cost them anything. And I have got very, very little pushback from people. And as the word of us going out has gotten out, what I found a lot more frequently recently is that people who have stuff on their shelves, they've gotten rid of, say, Delta 8 products, and but they still have HHC, and they believe they still had H8, they believe that they were compliant. So we provide them some education. We tell them what is legal, was not legal, and we've had a really a great response so far.
Great, thanks, Shane. Any other questions, comments? I have just a few more slides to go through, but again, feel free to interrupt me. That was a great discussion. All right, so here's another edible product in a very colorful Rice Krispie square. So these last few slides I have are going to be about Delta-9 THC, right? And so our legal marijuana program deals with Delta-9, naturally derived Delta-9 THC. There is a synthetic pathway to make Delta-9 THC from legally sourced hemp CBD isolate. So it gets really confusing and hard to differentiate what is synthetic and what is natural when we're talking about Delta-9 THC. Testing isn't really an effective tool to distinguish the two. And really what we need to evaluate here are the manufacturer's production batch records or SOPs. We need to see how the cannabinoid was made. Mostly all manufacturers are unwilling to give that information. I would say probably because they know they're making it synthetically. And that's a massive red flag. If the manufacturer is not willing to explain that their product is synthetic or natural, it needs to be assumed synthetic. And so that is this product right here. It says it's 300 milligrams of Delta-9 THC. Well, is this THC synthetic or is it natural? We simply just don't know. The other thing here, even if we can't determine the synthetic or natural status of this product is still in violation of House Bill 948 because it is being sold at serving size per or milligrams of THC per serving and milligrams of THC per package. It's over those thresholds that are put in our legal program, right? So again, I know I've said this a bunch. Our legal program allows for 10 milligrams per serving and 100 milligrams per package. This is over that. It has 300 milligrams in a serving. I'm here to assume that one Rice Krispie is a serving. So this far exceeds that. And so even if this is truly a natural product, House Bill 948 also prohibits this product. Simply
Kathy,
yes.
If I can interject here, this the serving size violation is by far the most common violation I see out there.
And so to clarify, House Bill 948 puts a serving size of 0.5 milligrams per serving and 2 milligrams per package of Delta-9 THC. That is the limit that is allowable for naturally hemp-derived products. Anything over that is prohibited, and those limits are so low so as to keep a consumer from getting an intoxicating effect from consuming them, even if you consume the entire package. So here's another edible product here that contains Delta-9. Again, it's a green apple gummy. So it has all the same commonalities and trademarks we've been discussing, right? That has the nod to the Farm Bill and FDA warnings. It has, don't operate heavy machinery warnings, all the same stuff. And then we're going to talk briefly about Delta-9 THCA. So like we discussed last month, Delta-9 THCA is non-intoxicating. However, it easily converts with heat to intoxicating Delta-9 THC. And so this is another way for these manufacturers to skirt the rules with the Farm Bill. If they maintain that their Delta-9 THC is less than 0.3%, but they put a whole bunch of Delta-9 THCA in the product, it becomes intoxicating when it is smoked. This is for products that are consumed with the use of heat. And so that's why we have some pre-rolls displayed here and this vapor cartridge. So these products, yes, they have less than 0.3% Delta-9 THC, but this one on the left has 40% THCA, which means that when this is smoked with the application of heat, this product becomes intoxicating. And so the total Delta-9 THC on this product on the left is 35.38%. And with our Montana state definition of hemp that includes total Delta-9 THC, not just Delta-9 THC, includes the total, this product in the state of Montana is also prohibited. Federally, this product is not prohibited. So our state definition of hemp is more restrictive, and it does capture these products that are high in Delta-9 THCA. So same thing over here on this infused pre-roll. It says in this kind of little star blast right here that there is, this product has less than 0.3% Delta-9 THC. Well, it's got 25% Delta-9 THCA, which means the total is 22.23%, which means, according to Montana, this is not a hemp product. This is an illegal marijuana product. And so these products are prohibited in the state. They are technically allowed by the federal government under the Farm Bill. So these ones are kind of tricky. These particular products are hard to explain to customers because there's a little bit of math involved. There's a little bit of chemistry involved. However, I think just sitting down and, either through the use of educational materials or just open conversation, you can get most people on board on understanding that that this is indeed an intoxicating product and in Montana, a prohibited product. All right, well, that's the end of my presentation. Are there any questions? Are there any products you'd like me to flip back to for further discussion? Happy to discuss anything more. We can talk about some C of A's again. What do you guys think?
Thanks, Kathy. Can you guys hear me okay? This is John.
Yep.
Oh, hey. No, that was a great presentation, and I think a good overview of what's out there in the market. And I just wanted to say I appreciated Representative Galloway's comment that these are the products that are just out on the open market, not associated with the current medical marijuana and adult use marijuana industry. So I think that's obviously an important distinction to make. I had just a couple thoughts going along. I mean, a lot of the, from a chemistry perspective, like THCX. You know, that's, you know, what is that? What is THCP even? We should be mindful of, you know, exactly what compounds we're talking about here. I think per the state definition for synthetic cannabinoids. So that's just, you know, important for us to keep in mind all these things. I can tell you that THCP is found at low levels in cannabis plants. There are academic papers for THCP presence. So that was just another random thought. And then some of the other cannabinoids as well can be found at low levels in plants, possibly in the acidic form, in this case, in plants. But then in concentrates, it would be, you know, that have been heated, they would be, you know, decarboxylated. So THCPA would be THCP, for example. So then the other thing was just kind of, you know, how would these products normally be allowed or be regulated? You know, I'm familiar with dietary supplements and I'm familiar with drugs. So these products aren't making any necessarily drug claims, but then that would put them in the dietary supplement realm. And then what would that process be normally? And I think that's just something we should keep in mind. House Bill 948 obviously explicitly bans all of these products. But I know from having looked at, say, Colorado, the Colorado comparable council to ours, they were considering those you know, pathways, and they seem to have, the state seemed to have a you know, a structure for dealing with some of the hemp products that would fall in those types of categories. So anyway, just wanted to mention that. But thanks for the presentation. That was helpful.
Okay. Thanks for your comments. Anyone else?
See,
out there?
Steve has his hand raised. Go ahead, Steve.
Yep, I'm just trying to follow the Zoom protocol. Just looking at it from kind of a law enforcement lens, have we considered, has it been considered to notify the out-of-state distributors because they're in violation of 948 by selling it to the retailer? So can we put the industry on notice that they can't even ship it to Montana?
Steve, that's a really great question, and actually a well-timed question. We are just kind of starting to do that, actually. I have been in contact with folks in Colorado where some of these manufacturers are stationed, and he has added us, the state of Montana, us to a list of states that prohibit these products, and we'll be taking that list to the manufacturers in his state to stop shipment of these products to our state. So we're in the very preliminary stages of that. We have, I believe, Shane, potentially, I think you've contacted some of these manufacturers as well and have shared House Bill 948 with them, letting them know that, yeah, sorry, go ahead.
Yep, that's correct. So when I find a banned substance for sale, I always take photographs of it so I know what they've sold in the past when I go back for my follow-up, and to keep a record of what we're seeing out there. And oftentimes I'll get the manufacturer distributors information off the packaging, and I'll often send a email or a letter to them advising them of House Bill 948, often sending them a link to it, and then saying they can contact me with any questions. The response has been, I've gotten calls from different distributors who have questions about House Bill 948 or didn't understand it. And for the first time this week, I was in a retail vape shop, and the owner said that their main distributor has them on in a database that says what can and can't be shipped to Montana. So they take their word for it. In this case, I found HHC products in the store, and when contacted, they thought they were okay under House Bill 948. So while there are people who are even trying to be compliant, they're not always being compliant.
Roger, thank you.
Yeah, and the other thing to consider here is, this presentation just showed products that are physically in retail stores. This doesn't touch on products that are sold online. That's a whole nother realm that's massive. And so something else to kind of keep on our radar along with the retail stores are the online stores as well. All right, any more questions, concerns?
What sort of
We have somebody
range?
who has raised their hand.
Oh, sorry.
CS 2705.
It looks like Representative Galloway also has his hand raised.
Yeah, I was just going to ask Shane a question. In section 2, we allowed for $1,000 a day penalty for those that are violating it. Seems like that would be a good thing to share with these distributors. And if you start finding online companies, I think that's another a deterrent for them to want to sell Montana residents.
Yes, sir. As of right now, what we're doing is we're basically doing, as we do these inspections, we're advising people of what that can't be uh, sold and why, and giving them an opportunity to get rid of things immediately. And I suspect that in the next couple months, we intend on taking a step further and talking about cease and desist and actually signing fines.
Jason, you mentioned that there was a CS couple of numbers person that maybe
They
want
put
to
their hand
comment?
down. So you're good.
Oh, okay.
Now,
Great.
all hands have been done.
Great. Okay. All right. Last call for questions. I'll give you a couple more seconds.
Hi, this is Isaac Coy, CS 2705. Somehow I joined as a not as a panelist. So even though I was raising my hand, I couldn't talk when so I had to get out and come back in. Sorry about that.
Sorry.
I was just gonna say, I know I think it might be a little bit beyond, maybe it's beyond the scope of this group, but I do think maybe working with our substance use prevention specialists in communities, or even some of the treatment providers, the information you presented, Kathy, might be a good educational material for some of those, so that they could also carry on that information to the schools they work with, or the I know our prevention specialists work with like Town Pump and others for product placement for alcohol and tobacco products, and this might be good information for them as they do their work in the communities.
Yeah,
Because I'm sure all of them are aware of, like, the honey lips, for instance. That one got me. I was like, what? That looks just like Honey Smacks.
Yeah, it does. Yep. Yeah, I am more than happy to, present, or educate any of your prevention folks and sort of help them on any of that, or maybe just educate them themselves on the issue here. If you want to put me in contact with any of your folks, I'm happy to do that. I gave a presentation on this to a marijuana, some sort of kind of conjoined marijuana group with DPHHS, maybe about a few weeks or a month ago. I'm not sure if any of the people you're talking about were part of that or not. But like I said, I'm happy to provide any education where it's needed.
Excellent.
All right. Well, there's no more questions. We've got about 25 more minutes or so of the meeting. So at this point, let me stop sharing. Okay, so for the rest of the meeting, I was just kind of thinking that what we could do is have an open discussion on, we can continue discussing the products that I presented on, that's fine too. Or we can go on to discuss perhaps some of the research that you may have been able to find over the last month since we last met. Like Andrew mentioned earlier on, as you guys are acquiring all of this information and research, feel free to pass it on to myself or Andrew, and we can get that posted on the website so everyone can see it and access it, including the public. And then further down the road, as we kind of get our feet underneath ourselves administratively and with information, we can start discussing, these definitions that we need to come up with, and some of the other marching orders that are put in House Bill 948. So with that said, I know that this last month was crazy and full of family and holiday stuff, and if you were able to find any research during that craziness, we would love to hear from you. So does anyone want to just stand up and start talking, or I'll let you guys kind of sort that out in a couple of seconds here.
I didn't know if we were on. Yeah, this is Eric Woodland. I focused more on section 3, item 4B, which is the recommendations for potential guidelines for manufacturing, to see whether there are any currently prohibited products that could be manufactured in what they call a safe, effective way. And it looks like there are quite a few, and some of them have been around for decades. I'll now forward the articles and the journal articles to Andrew so that they can get on the website. And you alluded to it during your presentation as well. It's a pretty simple process to take CBD derived from hemp and convert it directly into Delta-9. And a lot of the processes were well over 99% conversion. So the byproducts or impurities were under 1% routinely. And there are even quite a few patents for individual processes that have been granted. So if the next legislature wants to consider potential guidelines on how to do it, it looks like they're out there on how to get Delta-9 from CBD, which comes directly from an industrial hemp. So I know there's a lot more to explore, but at the first blush, certainly it looks like that's out there.
It's like John. Go ahead, John.
Thank you. Yeah, and to follow up on what Eric just mentioned, I compiled a number of patents, and the processes would appear to be producing highly pure finished product materials. So I can share what I found as well on the patent front. I've got the links. I also listened to a podcast from a person who has worked in the FDA regulated industries, developing drugs. He had quite a nice set of credentials. They are using, and they're not the only pharmaceutical type entity, they are using synthetic cannabinoids. I think they were focusing on Delta 8 possibly, but I'd have to review that to be sure. But regardless, they're using synthetic cannabinoids for the reasons to be able to control control the purity of the product better, and produce at scale. And there are a number of companies doing that type of thing. They're on the track, of course, of FDA regulated process, CFR 211. So that's happening.
Yeah, interesting. Thank you. Eric, in your research, you were just mentioning Delta-9 specifically. Did you find any other information out there that covers other cannabinoids outside of Delta 9?
Yeah, there were a slew of them. You can go,
Okay.
you can make 10 or 20 different products. I was just focusing on Delta 9 because the state of Montana has accepted Delta 9 as a legal product under CCD regulation. So it seems like if the industry was able to make Delta 9, it would be much less of a concern than if they made these unknown, much less studied compounds that we really don't know that much about. Seems like Delta 9 would be the first place to look, as opposed to making some of these more exotics that were really just intended to work around the regulations. But they can make most anything from it because CBD is a really good precursor for almost all of it.
Yeah. Yona, your hand is raised.
Yes, I just wanted to add to that comment, because when we're talking about synthetic cannabinoids, I noticed the synthetically created cannabinoids may or may not include naturally occurring compounds. So because I started kind of looking at the definitions that are out there already, and sometimes that's part of the definition, sometimes it's not. But I guess I just thought it'd be important for us to kind of think that through, whether we, yeah. And I think we probably should include synthetically created cannabinoids that are naturally occurring in our definition to kind of make those illegal too. But anyways, yeah, that's a different discussion, I guess. But it will be part of our discussion on how we want to define synthetic cannabinoids.
Yeah, absolutely. I have been putting together a list of different states who have tried to tackle this this whole definition stuff prior to us. So I've compiled all of those.
Okay.
Well, some of them, and we'll get those put up on the website for everyone else to see. And perhaps next meeting would be a really good time to start kind of diving into that definition and set some parameters down. And like we've discussed, and like you said, we have to be very careful and diligent about this definition to make sure that we're not inadvertently causing harm to the legal marijuana program that's already established, while also achieving the goals of of prohibiting the synthetics as well. And so there's a lot of convoluted and complexities to that definition. And so yeah, like I said, I'll get some of those other state definitions up, and we can all review that in the following month and return and start having some discussion on that for sure.
Perfect. And I'll maybe forward you the definitions I have found as well, more from like international government agencies and European government agencies that they were using.
Definitely. That sounds great. All right, did anyone else have some research or information that they found to share? That was kind of a hectic month. Representative Galloway, go ahead.
Just my observation, this isn't really my realm, but, as a legislator, I was brought a problem and we looked for a solution. I guess the complexity I see is that we have, if I understand it correctly, a seed to sale program, and we're trying to protect that in a way of those that are doing it legally. When you get into synthesizing, and I guess to me, there's such a complexity of how do we protect that seed to sale if we're going to start allowing things to be synthesized. So I would welcome anybody who can help me wrap my brain around the direction that we could possibly entertain, because it just seems like it opens a big can of worms.
So I can speak to that a little bit. I operate in the seed to sale system, and from right now, it is like you said, from seed. So there would be, if we were synthesizing in our lab or manufacturing any of these cannabinoids, at some point, the precursor, whether that's CBD isolate or hemp flower or something, would have to enter that seed to sale system, which it really can't. It's kind of a closed system. So if we, you know, were ever to say, okay, it's okay to synthesize Delta 9 or something like that, again, like you said, it's a can of worms. And really the economic incentives don't align. It makes more sense to extract it from the plants we're growing that have naturally occurring THC than to look to hemp for it. But yeah.
Yeah, and so currently, like everyone knows, House Bill 948 prohibits synthetic cannabinoids. However, there is some language in the bill that also charges the advisory council with finding or coming up with recommendations on potential guidelines for safe methods of manufacturing, extracting, and synthesizing cannabinoids, including the sale of synthetic marijuana products. Since the language says potential guidelines, I think that we are open to say that there is no safe guidelines to do this within the state. That is an option, I think. And then you kind of thinking bigger picture about this. I'm not sure, you know, if we do find safe guidelines, I'm not sure Department of Revenue is the appropriate agency to oversee that, or if there would somehow be a federal framework that exists that we could insert this into. That's kind of beyond my understanding of how this would work. However, I do know that, you know, these synthetic products are undermining our legal program, and you know, these products are not taxed. The people making these products do not pay licensing fees. They are not paying for testing. They are making a lot more money much more easily than the folks who are in our legal program. And so that's definitely something to consider as we're sitting here discussing this, and something to consider as we're thinking about, well, if we wanted to try and legalize this, and some of the barriers to doing this as well. You might physically be able to do this at high concentrations in a FDA regulated laboratory, but what are the ramifications to our legal program? Is that something that we still want? Shane, your hand is up.
Just from what I'm seeing in the field, and full disclosure, my background is in law enforcement, not in science. But it just seems to me that I see new products all the time and things being changed all the time, and there's so many scientific details that sometimes determining how things are processed and produced is hard to tell, certainly in the field. And I could see it being very challenging to not only to set guidelines for processing, but be able to determine that actually happened or not, especially when they're coming from all over the country.
Could I ask Representative Galloway to maybe speak on, since it seems like maybe we have different interpretations of 4B, the recommendations for guidelines. Could you maybe guide us a little bit on if the legislature is interested in finding out if there are safe guidelines for manufacturing, say Delta 9 or any others? Or are we strictly looking to basically prohibit all synthetics, period?
Well, if I was to go back when we were developing this, and we did it in a very short period of time, Aaron did a wonderful job of drafting this bill. My whole, and I didn't really read this section clearly enough, but my whole intent, or my understanding for the advisory council really is to be able to help keep on track of all of this new stuff that it just seems like if we make this illegal, they just go find another avenue to try to make something else that can skirt the issues. So that was my whole hope that that's what the intent for the advisory council. Like I said earlier, I don't see any way to administrate a program like we have for marijuana or these other products. And I guess that would be what you're charged with. If you find another state or an avenue that makes sense, then I guess we could entertain that. But you know, my biggest concern is for our kids and for users of these products. We are keeping them in the realm of safe, and that they can rely on, that we're not allowing things that are harmful, which you could see today's presentation. There's plenty of things that need to be off those shelves. And I can get it from the people that have invested in their businesses and paid the fees to do a legal program, when the guy across the street's making the big profits on items that aren't legal. And that's where our city contacted me, is because they were being threatened to be sued if they didn't shut those operations down, but they really didn't have the legal or means to do it. So I think there's no issue I would have with us rolling out a program if we can find a safe, reliable system to put in place to regulate it.
Thanks.
All right, any other questions, comments, discussion?
I would have another comment.
Sure, go ahead.
I'm just curious, with the helpline, has that ever gotten established, and is it having any success with people reporting?
So I'm assuming, are you talking about the synthetics complaint line?
Yeah, I think that's.
So maybe Andrew can double check me right now. So there is a complaint link on the DOR website that is specific to synthetics. I personally do not monitor that. However, I would have been forwarded any complaint that would have been submitted to that, and I have not received anything.
I can add on to that. I can tell you that the complaint line is up and running, and it is operational, and we've received honestly very few actual complaints from general public.
All right, John, go ahead.
Oh, thanks, Kathy. I just to follow up on I made a comment earlier about Colorado, and their let's see, they have had a essentially equivalent council. I did find their task force report in my online adventures over the last month or so, and I will share that. But there is, it looks like in the case of Colorado, they do have a little more structure at the state level for, you know, kind of like what we were just talking about, kind of, you know, bringing, you know, safe products that are possibly synthetic. Haven't finished the report, but at least it does kind of, it would be a nice report for everybody to take a look at and just kind of see a different perspective. But they touch on a lot of the stuff we've talked about, you know, from a bit on safe manufacturing, but very much on the definitions and the problem and what the compounds to worry about are and how the state should handle it. I will share that.
Yeah, great. Thanks, John. That'll be a good read, I think, for everybody.
Yeah, and last meeting you mentioned too, you might have had some other state information, possibly similar types of things. Because yeah, Colorado's the only one I could find so far. I think Oregon has done a similar, you know, something similar, but I couldn't find anything.
Yeah, so I was able to find, sorry Shane, I'll get to you in just a moment. I was able to find a couple similar documents of other states' advisory councils on the same or similar topics. And so I can share those as well. However, as a side note, I do believe that Colorado does actually prohibit these products. They may have some sort of regulatory framework in which these manufacturers can try to produce these products, but my understanding is that none of the manufacturers have been able to attain that yet. And so there are manufacturers that make these products that exist in Colorado that ship outside of the state. But my understanding is currently they're not allowed to sell inside the state of Colorado.
Yeah, I think that's correct. But I think, yeah, they are steered towards, FDA pathways, which is kind of why I mentioned that early on. And that's, that's the right pathway. But
Yes.
then as far as it getting into our seed to sale, getting into our seed to sale system, though, that's, I think that's possibly another pathway, but I know that's would be possibly a very touchy one. And, and I'm kind of I mentioned THCP earlier because THCP is found in plants. And so let's say somebody has a THCP heavy plant, just, by coincidence. I mean, none of the labs are analyzing for it, so nobody would know. But, that appears in the plant. So how do we deal with that at the state level here?
Yep. Yeah, absolutely. And then also one quick side note here is that, we're all here discussing this because of the definition of hemp in the Farm Bill. And there is federal discussions, high level discussions right now going on about if this definition of hemp may be changed in the coming year when folks are working on that Farm Bill. So something to kind of remember that, we may be sitting here trying to come up with a framework to make this legal, while in a year the definition of hemp federally may change, and who knows which way they're going to go. So kind of it throws a wrench in kind of the whole deal, but something to be aware of for sure. Shane, let's call on you, and then we'll probably be getting toward the end of our meeting here.
I don't think my hand was ever lowered for my first question. I think I'm good.
Oh, great. Okay. Representative Galloway, go ahead.
I've really enjoyed being able to participate today, and I know I'm not part of this, but if you could, it would be allowed for me to be tied to my email, any of the information that you're disseminating, it would sure be helpful for me to kind of be able to ascertain where we're heading, or if there's a direction, or if there's anything that I can do.
Yeah, I don't see a problem with that at all.
Thank you. Thank you for allowing me to participate.
Yeah, you bet. And as a reminder, as we gather resources, they will all go on the Synthetics Advisory Council page on the CCD website too.
Great. So we're running out of time here. I don't want to keep anybody too late. We were discussing sending out a contact list for all of us to just have names and emails. And now that we know that we can communicate freely, generally with email, as you come across resources, feel free to send those over to myself or Andrew, and we will get them onto the website for everyone to see. So we'll also, I'm assuming Andrew will be sending out, I know he will, he'll be sending out a request for setting up our next monthly meeting. In the meantime, I don't have any specific marching orders for folks other than to just gather as much information as you can. I think this is the stage where we really just need to educate ourselves as much as we possibly can, see what other states are doing. And so, in our following meetings, we can be as prepared as possible to come together and discuss these different definitions, manufacturing processes, what a legal landscape might look like, if that's something we want to entertain. If not, that's fine too. And then we can discuss and see where this whole process takes us. Any other outstanding questions or comments before we close? Okay, not seeing any. All right, guys. Well, thanks for a really productive meeting. I appreciate all of you and your time and your expertise. And I look forward to seeing you in about a month.
All right, thanks, Kathy.
You bet. Thanks, everyone.
Thank you, Kathy. Thanks, everyone.
All right, Andrew, I'll stop recording.